News from Nepal. Nepal's active caseload skyrocketed from less than 5,000 to more than 50,000 within the first 20 days of 2022. Coronavirus infections have surged due to the spread of the Omicron variant and has severely affected frontline workers as well as leading medical staff as third wave of COVID-19 sets in the Himalayan nation.
As the third wave of COVID-19 cases is raging across Nepal, the capital city of Kathmandu is witnessing long queues of frontline workers standing in line to get tested for COVID-19. In less than a week, the Omicron variant has forced more than 500 doctors and health workers at various hospitals in capital Kathmandu alone to isolate, cutting them off from the duties. Already bearing the crunch of shortage of health workers at various departments inside the capital, the government has reduced the isolation time period to 5 days. Many of them are being treated at home isolation and the hospital.
I think this third wave is going to bring human resources cry a lot, because a lot of healthcare workers are getting infected day by day. If you look into the data, bigger hospitals of Nepal like Bir Hospital, Teaching Hospital, more than hundreds of healthcare workers are getting infected. So once they have to go for isolations, we will not be having adequate amount of healthcare workers to take care of the patients.
Some regional and district hospitals outside Kathmandu Valley have been hit hard with the surging case of infection amongst healthcare workers. Many districts have been reported to hold some of its services as it doesn't have adequate staff to look after the patients after the majority of the staff tested positive for the contagion. Similarly, the Bharatpur Hospital in Chitwan district, considered as one of the prime locations hosting large numbers of doctors and medical students, also has been quarantining the majority of its staff. Despite reeling through 2 deadly waves, Nepal still remains unprepared for the third wave. Nepal currently has 50,328 active cases and a positivity rate standing around 45%. Keeping in mind the current situation, the Nepali government earlier this week has started booster doses owing to the risk that lies ahead. The Ministry of Health and Population also has decided to administer a third dose to all people above 60 years inoculated 6 months ago, as well as to those with compromised immunity from January 28.